At least 30 babies are born daily here at the China-Uganda Friendship Hospital in Naguru, Kampala. The medical staff have to ensure that all the babies go home alive. And a cry is the first indication that any will. The baby's health status will then be rated from 0 to 10.
If the skin is pink, okay, then that baby is doing well. Sometimes you deliver the baby and it's flat. There is no activity. You don't even see it either raising the arm or the leg. There you know that things are not okay.
A score below 7 indicates poor health. At least 16 babies here registered such weak scores.
So you have to clean the nostrils if there's anything blocking the nostrils, and then you try to stimulate them. If you find that they are not breathing, then you have to aspirate. There are gadgets we use, either bulb syringes, to aspirate the mucus from the nose.
This book indicates that each month, 13 to 16 babies had to be helped to breathe.
That baby can be assisted by simple skills that we are trying to transfer to the health workers of resuscitating babies using what we call an arm bag and a face mask.
Patrick Aliganyura, the program specialist in charge of saving the newborn lives at Save the Children in Uganda, says the NGO donated breathing gadgets to Naguru Hospital and they were put in this corner in the labour ward. Knowing the cause of death is what has to be addressed.
When the baby comes in with the signs and symptoms of an infection in the hospital, an injection of a drug called gentamicin can save a baby's life. We are saying if, for example, babies who are being born too soon or before 9 months, if they come into the hospital and they get an injection of a corticosteroid or dexamethasone, like health workers know it, that can help the baby's lungs to mature very fast and to be able to establish the first breath at birth.
One of the key challenges of this hospital and in many health facilities across the country in stopping infections to the newborns is limited space.
You have seen there are like 6 delivery beds there, but at times you find all of them have mothers, others are delivering on the floor. So that one, of course, if a mother delivers on the floor, the baby picks up infection immediately from there. So this baby, within a day or 2 days, will be very sick. And then that will contribute to the early neonatal death and the infant mortality, the high one we are talking about.
For babies born too soon and small, kangaroo mother care is highly recommended.
Holding the baby onto the mother's chest or any caretaker's chest, skin to skin, to be able to transfer the warmth from that person to the baby.
Dr. John Wanyama, an obstetrician gynecologist at Naguru, says a song would probably have to be recorded about the need for mothers to come early to health facilities. It's because this delay is one of the leading causes of newborn deaths.
Somebody should deliver within 12 hours. But if there's a problem, you will find that it will take longer than that. Or for instance, if somebody needs an operation, if an operation is not done in time, you find that the baby gets distressed, okay? And eventually, if something is not done, the baby will die inside the womb. That is if not the mother can also die because of rupture of the uterus.
Ideally, all mothers should be delivering at the very minimum with the help of a midwife, but that is not happening to the desirable frequency. Save the Children in Uganda is now working to ensure that 10 districts in the country have the basics to help newborns survive. But Uganda has 112 districts, yet even the 10 don't have some of the necessary equipment used. Clearly, therefore, there's still a lot of work to be done. Even after the babies leave the health facilities, they may not be safe at home, and some die within days.
There are diseases like respiratory tract infection, they get pneumonia. Some of them get malaria. Some of them get malnutrition. Others get diarrhoea diseases because of the poor hygiene.
So the parents have to create the right environment that favors the healthy growth of their babies.
And also the babies should be breastfed exclusively for at least 6 months before you give them anything else. But what happens in our setup, the baby is born and then the mother starts giving water which is not even boiled.
All this information is given to parents during antenatal visits. Unfortunately, only a few make these. Most countries have been working to achieve UN Millennium Development Goal 4 of improving child health, especially reducing the deaths, but less than 500 days are now left to that deadline.
Let's provide the right equipment and medicines in the facilities. If we address that challenge, that means we are trying to save over half of the babies that are dying.
Uganda, like many others, is now focused on the post-2015 agenda. Florence Nalimba, NTV.